Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Right, next up we have.
Hi everyone, long time no speak. So I've been doing really well, and in the last few weeks, however, I have started to be more easily triggered with my eye symptoms. It's reminding me of how, because I'm not currently working, but it's reminding me of how it was when I was working, and there was a lot of stress happening last year in the midst of when my post concussion symptoms were the worst.
Mm-hmm.
It's not nearly as bad, thank God. But it's stored. I'm more easily triggered, I noticed. The one common denominator that I realized had happened over the last few weeks is I've been going to a chiropractor who has been doing a lot of amazing muscular work because I had a lot of tension in different parts of my body, and that's been working really well. However, the reason I went to the chiropractor is because my hip was bothering me and my shoulder as I've been running more to ensure I'm doing the cardio that's recommended, at the specific BPM. And so the only thing that I haven't been doing over the last few weeks is the cardio. And so of course I don't know for sure, but I'd like to hear what you guys think. That's the one thing that I haven't been doing. And I'm going to vision therapy, which seems to be helping tremendously. But again, I'm more easily triggered. So what I'm thinking might be happening is that because I have this lack of cardio in recent weeks, it's sort of not balancing my nervous system as it was. Perhaps it has something to do with blood flow. I don't know. But I just wonder if you had any thoughts or if that sounds right, because I'm working my way back into cardio this week. Now that my hip is feeling better, it was super tight. And like I mentioned, I got some work done on it. So it's feeling like I'm slowly working myself back into it. Yeah. Do you think that sounds like a decent hypothesis, or any thoughts on that?
Yeah, so just so I understand it correctly here, you're saying that because you've been getting more care for, I think you said your shoulder, right? And there was one other thing, your knee?
My hip.
Your
That's
hip.
what stopped me from being able to do the cardio.
Right. Yes, okay. So because you haven't done that for a couple of weeks, you feel like you're getting more symptoms?
No, yeah. So basically, I haven't been able to do cardio for probably a little over 3 weeks.
Okay, 3 weeks. So you're thinking that that's because you're more symptomatic, that because you haven't been able to do that cardio. Have you been able to do any sort of other type of exercise during that time?
Very slowly, like doing some PT, like simple exercises related to my hip and my shoulder.
Mm.
So not working on, and I am actually, to be honest, someone who works out regularly, and when I don't, like I wouldn't, I don't have like heavy anxiety, but if I don't work off my energy, I definitely see an impact there in terms of anxiety when it comes to stress.
Yeah, I mean, that's an important consideration, and it sounds like you're just being really mindful about it, that you're able to make those connections. I mean, 2 to 3 weeks is a pretty short period of time. But again, I think if you're a sensitive person that really relies on that movement, could it increase symptoms? possibly, one of the things that comes to mind is, okay, so if you have, and this goes for anybody listening, if that there's any sort of physical limitation that you have, for example, hips or a shoulder, is there a different type of movement that you could do that maybe isn't in line with what you were trying to do before? Maybe with Dr. Cam's recommendations, definitely trying to increase some of that steady state cardio, getting up to some of those thresholds. If for whatever reason you're sidetracked, I would really encourage everyone, okay, find another option to try to do that cardio. If you can't do the cardio at all, because hip affects lots of different things in terms of movement, then can you do some resistance training to still get some of the adaptive effects of exercise? So if you have two things going on, both shoulder and hip, there's quite a bit of limitation there. So maybe can we do something like a rowing machine if possible? Again, there are lots of variables on whether you might have access to this, but maybe I encourage you, while you're trying to get this rehabilitation happening, so do those rehab exercises, but then still try to get your heart rate up in any way possible, even if we're going to try to do it in a little bit of a resistance exercise way.
Was there a sense of, just a question, as maybe this was answered in a previous question you had, around autonomic dysregulation, where Dr. Cam had recommended only steady state cardio, or was that okay?
Well, I guess I don't know too much more about this particular person's case in terms of if there's autonomic dysfunction. Can you comment on, again, your top symptoms right now?
So it's more that my main symptom throughout this whole time has been eye pressure, like eye pressure headaches. And so what I noticed is, like, if I'm looking at, I've come so far in terms of being able to be on screen. But what I'm noticing in this last few weeks is sometimes immediately now when I look at my phone, I will have like not a major rush, but enough of a rush to notice the eye pressure symptoms. Like that's my big, and it reminds me of how I was when my symptoms were very bad. So
I'm curious, Dr. Cam always mentions this, and unfortunately he's not here today to sort of help support. But I'm thinking about that sense of, exercise benefit is sort of warming up the muscles and helping them to relax. That's one of the key messages Dr. Cam's always saying. So I'm hearing, maybe without that, you're starting to notice some of this tension that can create, it could be the neck dysfunction or something else that's creating sort of these visual symptoms. So I think, to Dr. Paul's point, seeing if there's a way to continue getting some of that exercise, even if it is, weights or resistance training, as long as you aren't experiencing that autonomic dysfunction piece, in which Dr. Cam consistently recommends steady state cardio only, which can be really restrictive if you have other injuries, because there's really only 3 options he recommends, which is the treadmill, a recumbent bike, or the rowing machine, or walking outside.
Yeah, I'm gonna talk to my visual therapist later today as well to see if she thinks there's something happening with, if it's related to like looking down at my phone. Although, like I said, it was doing so well, so it's a little bit odd. I think the other question or related question I have is, so when doing the cardio and getting my my heart rate up, is that helping my autonomic nervous system? Like, is like regulate it? I wanted to understand that. Or is it doing something, or is the cardio, and getting my heart rate up doing something else? I know it's probably not that simple.
There's kind of 2 different ways to answer that, Dr. Paul. Go for it if you want.
Well, I mean, okay, so I think just understanding it simplistically, one of the things in autonomic dysfunction is that you have trouble regulating blood flow. That's like at the core of what's going on. And what regulates blood flow is your autonomic nervous system. And so when you are moving your blood more because of you're moving your muscles more, you are challenging that vascular system and therefore the neurovascular system that supports the blood flow, aka your autonomic nervous system. So think of it like training and conditioning that nervous system. So when you're challenging it, you're basically challenging the threshold of, okay, these are my limits. And then all of a sudden it starts triggering symptoms. You want to continue to kind of push that. Now, if your main symptom is you're getting kind of pressure headaches, then obviously that's a big one when it comes to neck issues. And that may or may not be related to autonomic dysfunction. In my experience, it often isn't, and it's related to some kind of more structural issue. Autonomic dysfunction is really related. One of the key tests is like, can you pass the treadmill test? And have you done that?
Yes.
And have you passed it?
Yes.
Then you don't have autonomic dysfunction, most likely.
Okay, and so this is the other thing that, if you don't mind, just to kind of continue a little bit. This is something I just spoke yesterday to the chiropractor about. He basically, over the last few weeks, has done a lot of muscular work in terms of relieving tension around my neck into my shoulder, also around my hip, like down throughout. And he's like, he thinks I'm doing really great. He's noticing that, and I know this is more of a Dr. Cam question probably, but he's noticing that he wants to do some adjustments to the joints in my neck. Like C2 seems to be an issue.
Okay.
So we're planning to do that next week, but because I told him that really, like, I haven't been able to do the cardio and I want to start working on that, like, in case that's impacting me, he's like, okay, so work on that over the next week. And once you sort of get yourself back on track, that'll be less of a factor, perhaps, when we start working on the neck, so we can, like, sort of isolate, see if this is
right.
that could be the issue. So yeah, it's good to know, like you mentioned, that the eye pressure issue could be more of a structural thing. And that kind of a light bulb went off when he mentioned that in terms of the joint. So hopefully that will do something. I mean, this is just all so wild. Like, I just cannot get over this over and over. How many? It's just wild. Sorry.
It's very complex, right? It's very complex.
So
it's like putting a puzzle together, which was kind of our inspiration for developing this program in the first place, is that it's really tricky to navigate. And without a bit of structure, it can be hard to isolate the variables that are causing the issues. So hopefully that helps a little bit, right?
Yes,
we're hearing that there
definitely
is an autonomic dysfunction, so that you should be able to do other forms of exercise, resistance, weights, whatever, to kind of help with blood flow, help with that outlet for anxiety, because that's a big one too, right? Anxiety is that other factor we didn't even touch on yet that can mimic symptoms of concussion. So just, keeping that in mind as well. What are your outlets? If your outlets are exercise, you don't have autonomic dysfunction. Okay, so bringing in exercise in different forms that can help support you right now. And then just kind of working on each variable and giving yourself time, right? I think it sounded like your provider was quite good, choosing one variable. Let's sit with that for a week and see how you are. Now let's think about the next variable, instead of trying to do everything all at once, because that can really overwhelm your nervous system.
Mm-hmm. And if that chiro is working on your neck right now, then that is another factor that could be making symptoms worse, just again, and transiently. So again, it sounds like, just based on our conversation, there isn't much autonomic dysfunction. So talk to your chiro about, okay, so if I can't do my normal cardio, then is there types of exercises I could do that is okay with my current MSK limitations, your structural limitations, but I can still get some of the benefits? Because, you have to be careful, like certain types of, exercises can make your neck pain, tightness maybe worse. So that is a key question to ask. And then just remember, if they're digging around in your neck right now and starting to do some work, and maybe this needs to happen, you may actually feel a little worse before you feel better. And you might be on the right track if you're getting more symptomatic. So it could be a little bit of a silver lining that this has paused your current approach, and really personalized what you need to do. And maybe you just need to work on a particular type of set of movements that's going to strengthen the weak areas of your neck. And that's where I'd be asking the chiro.
Right, exactly. Okay. I know I say this every time, and hopefully you guys aren't sick of hearing it, but I just am so grateful for this program, and all of you are just so wonderful at answering the questions and so compassionate. I just
Mhm.
appreciate it a million times. Thank you so much.
Very
You're so welcome.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.